let's get to the thyroid. So where is the thyroid located?
It's located here in your neck.
Here.
Yes.
Right, in this area. And so the function of the thyroid, because it might be a small gland, but it's a very important gland.
That's true of hormones in general. They may be small, but they do a lot of important work. What the thyroid gland does is it secretes thyroid hormones, of which there are two. And those thyroid hormones circulate throughout your body. They then bind to receptors. That's what makes it a hormone. And those receptors have actions on things like your liver and your heart. But basically, you can think about the thyroid gland as controlling many aspects of metabolism and energy.
Now, is there a connection between the thyroid and the pituitary gland as well?
Yeah. The pituitary gland, which is located at the base of the brain, is the master gland. It secretes many hormones, one of which is thyroid stimulating hormone, which stimulates the thyroid gland to release thyroid hormones.
And there's also different lobes. I feel like I'm getting a whole anatomy lesson here. So there's also different lobes, correct?
Exactly right. In the illustration that you have, there's a right lobe and there's a left lobe. And there's a central portion called the isthmus, which is the bridge between the two lobes.
Okay. Now, correct me if I'm wrong, doctor, but often you hear someone say, well, I've gained weight because of a thyroid issue.
Yes.
Is that normally the case?
It can be.
It can
however,
be. There's a however in there.
Most people who gain weight have normal thyroid hormone levels. If only life were so simple that every person who has a weight problem, we could just change their thyroid hormone levels and solve the problem. So yes, thyroid hormone abnormalities, either too much or even too little, can be associated with weight problems.
Okay. Now, there are also major muscles surrounding the thyroid. So what are these muscles exactly?
Yeah. So the muscles of the neck include this big muscle on the side called the sternocleidomastoid muscle. That's when you can see the bigger one. And the little ones in the middle are the sternohyoid and sternothyroid muscles, which are much less important and actually can serve great function, because if we have a cancer, we can sacrifice some or all of those muscles and protect the patient from their own tumors.
Okay. Here's a question I have. Can you actually pull a muscle in a thyroid?
Pull, like pulling a leg muscle?
You know how yes, in a thyroid where you have the left and the right, can you actually damage them?
Well, we can damage them as surgeons. It'd be hard for a patient to damage their own muscles. Yeah.